Welcome back to my channel. How to do first aid on choking baby. If you ever find yourself in a situation where you have to administer first aid to a choking baby, it is important to be prepared. The recommended procedure is to perform back blows and chest or abdominal thrust to dislodge the blockage, followed by modified CPR if the baby becomes unresponsive. Be aware that there are different procedures to follow depending on whether you are dealing with a baby who is less than 12 months old or a baby or toddler who is older than a year, both of which are outlined below. Assessing the situation. First, allow the baby to cough. If the baby is coughing or gagging, this means that their airway is only partially blocked, so they are not being completely deprived of oxygen. If this is the case, allow the baby to continue coughing, as coughing is the most effective way to clear any obstructions. If your baby is making choking noises and they are old enough to understand you, try instructing them to cough or demonstrate how to do it before administering first aid. Second, look for symptoms for choking. If the baby is unable to cry or make noise, their airways is completely blocked and they will be unable to remove the obstruction by coughing. Other symptoms that indicate choking include producing an odd, high-pitched sound or an inability to make any sound at all, clutching at the throat, skin turning bright red or blue, lips and fingernails turning blue, and unconsciousness. Third, do not attempt to remove the obstruction by hand. Whatever you do not attempt to remove the obstruction yourself by sticking your hand down the baby's throat. This may cause the object to become lodged more deeply or damage the baby's throat. Call local emergency services. If possible, once you have ascertained that the baby is choking, your next step is to perform emergency first aid. If the baby is deprived of oxygen for too long, they will lose consciousness and may suffer brain damage or even death. In such an emergency situation, it is important to have trained healthcare professionals on the scene as quickly as possible. If possible, have another person call local emergency services immediately while you are administered first aid. For your local number, check how to call emergency services. If you are alone with the baby, start administering first aid immediately. Do not this for 2 minutes, then stop and call emergency services. Resume care until the healthcare professionals arrive. Note that if the baby suffers from any heart conditions or you suffer that they are experiencing an allergic reactions where the throat closes up, you should call emergency services immediately even if you are alone. Second, performing first aid on babies less than 12 months old. Position the baby correctly when administering first aid to a baby younger than a year. It is important that you support the head and neck at all times. To get the baby in a safe, professionally recommended position for administering first aid, do the following. Slide one arm under the baby's back so that your hand is cradling their head and their back is resting against your forearm. Second, performing first aid on babies less than 12 months old. Place your arm firmly along the baby's front so there is sandwich between your forearms. Use your top hand to securely grasp the baby's jaw between your thumb and fingers without covering their airways. Gently flip the baby onto their front so they are now resting on the opposite forearm. Their keep head supported by the jaw. Rest your arm against your thigh for added support, and ensure that the baby's head is lower than the rest of her body. You are now in the correct position to perform back blows. Second, perform 5 back blows. Back blows create pressures and vibration in the baby's airways, which is often enough to dislodge any stuck objects. To perform back blow on a baby less than 12 months old, use the heel of your hand to firmly hit the baby on the back between the shoulders blades. Ensures that you are adequately supporting the head as you do this. Repeat this movement up to 5 times. If this does not dislodge the object, move on the performing chest thrust. Third, reposition the baby. Before you can perform the chest thrust, you will need to turn the baby over. To do this, place your free arm, which you were previously using to perform the back blows, along the baby's back and straddle the back of her head in your hand. Gently turn them over, keeping your other hand and arm firmly pressed against your front. Lower the arm, supporting the baby's back so that each resting against your thigh. Again, ensure that the baby's head is lower than the rest of her body. Fourth, perform 5 chest thrusts. Chest thrusts force the air out of the baby's lungs, which may be enough to dislodge the object. To perform a chest thrust on a baby less than a year old, place 2 or 3 fingertips in the center of the baby's chest, just below their nipples. Push inward and upwards, applying enough pressures to complete the baby's chest about 1.5 inches or 3.8 centimeter. Allow the baby's chest to return to its normal position before repeating up to the 5 times. When compressing the baby's chest, ensure that the movements are firm and controlled, rather than jerky. Your fingers should be in contact with the baby's chest at all times. 5. Repeat until the obstruction is dislodged. Alternate between giving the baby 5 back blows and 5 chest compressions until the object becomes dislodged. The baby starts crying or coughing, or the emergency services arrive. 6. If the baby loses consciousness, perform modified CPR. If the baby becomes unresponsive and emergency services have still not arrived, we will need to perform modified CPR on the baby. Be aware that modified CPR is different from normal CPR, as it is tailored to be performed on small babies. Third method, performing modified CPR on babies less than 12 months old. First, check the baby's mouth for an object. Before you begin CPR, you should check the baby's mouth to see if the objects they were choking on has become dislodged. Lie the baby on their back on a firm, flat surface. Use your hand to open the baby's mouth and look inside. If you see something, remove it using your baby finger. Even if you can't see anything, proceed to the next step. Open the baby's airway. You can do this by using your one hand to tilt the baby's head back slightly and the other to left their chin. Don't tilt their head back too far. It takes very little to open a small baby's airway. Third, check if the baby is breathing. Before proceeding with CPR, you should check to ensure the baby is not breathing. You can do this by placing your cheek very close to the baby's mouth, looking towards their body. If they are breathing, you should be able to see their chest rising and falling slightly. In addition, you may be able to hear breathing noises and feel their breath on your cheek. Fourth, give the babies 2 rescue breaths. Once you have confirmed that the baby is not breathing, you can begin CPR. Begin by covering your mouth and nose with your own mouth and blow 2 small rescue breaths gently onto their lungs. Each breath should last for about a second, and you should see the baby's chest rest as the air goes in. Pause between breath to allow the air to escape. Remember that a baby's lungs are very small, so you shouldn't blow too much air or blow too forcefully. 5. Perform 30 chest compressions. Once you have performed the rescue breath, leave the baby lying on her back and use the same technique you used earlier for the chest thrust. That is, using 2 or 3 fingers to firmly compress the baby's chest by about 1.5 inches or 3.8 centimeter. Press straight down on the baby's breastbone in the center of the baby's chest, slightly below the nipples. The chest, the chest compression should be performed at a rate of 100 compressions per minute. This means that you should be able to get through the 30 recommended compressions in addition to the rescue breath in approximately 24 seconds. 6. Give another 2 rescue breaths followed by 30 chest compressions and repeat for as long as necessary. Repeat this cycle of 2 rescue breaths followed by 30 chest compressions until the baby starts breathing again and regains consciousness or until emergency services arrive. Even if the baby starts breathing again, they will need to be examined by a healthcare professional to ensure that they have sustained no further injuries. Method number 4, perform first aid on babies and toddlers older than a year. Administer 5 back blows. To give first aid to a child older than 12 months, sit or stand behind them and place an arm diagonally across their chest. Lean the child forward slightly so they are resting against your arm. With the heel of your free hand, administer 5 firm and distinct blows to the child's back, directly between the shoulder blades. If this does not dislodge the object, move on to abdominal thrust. Second, administer 5 abdominal thrust. An abdominal thrust, also known as the Heimlich maneuver, works by forcing the air out of person's lungs in an attempt to clear any obstructions from the airways. It is safe to perform on a child older than a year. To administer an abdominal thrust, stand or sit behind the choking child and wrap your arms around your waist. Make a fist one on hand and place it firmly on the child's stomach thumb, side and slightly above the belly button. Wrap your other hand around the fist and deliver a quick upward and inward thrust to the child's abdomen. This motion should force air and any large object out of the windpipe. For smaller children, be careful not to thrust against the breastbone, as this could cause injury. Keep your hands just above the navel. Repeat up to 5 times. Number 3. Repeat until the obstruction clears or child starts coughing. If the child is still choking after 5 back blows and 5 abdominal thrusts, repeat the entire procedure again and continue to do so until the objects become dislodged. The child starts coughing, crying, or breathing, or emergency services arrive. Number 4. If the child becomes unresponsive, perform modified CPR. If the child still cannot breathe and loses consciousness, you will need to perform modified CPR as quickly as possible. 5 method performing modified CPR on babies and toddlers older than a year. Check the child's mouth for an object. Before you begin CPR, open the child's mouth and look for any objects that may have become dislodged. If you see something, remove it with your fingers. Number 2. Open the child's airway. Next, open the child's airway If tittling their head back and their chin upward, slightly check for breathing by placing your cheek next to the child's mouth. If they are breathing, you should either see their chest rising and falling slightly, hear breathing noises, or feel their breath against your cheek. Do not proceed with CPR if the child is breathing on their own. 3. Give two rescue breath. Pinch the child's nose and cover her mouth with your own. Give two rescue breaths, each lasting about a second. Make sure to pause between each breath to allow the air to come back out. If the rescue breaths are working, you should see the child's chest inflate as you exhale. If their chest does not inflate, their windpipe is still blocked and should return to the first aid procedures to dislodge the obstruction. Number 4. Perform 30 chest compressions. Begin chest compressions by placing the heel of one hand on the child's breastbone right between the nipples. Place the heel of your other hand on top and interlock your fingers. Position your body directly above your hand and begin compressions. Each compression should be hard and fast, and should compress the child's chest by about 2 inches (5.1 centimeter). Allow the chest to return to its normal position between each compressions. Count each of the 30 compressions out loud as this will help you keep track. They should be performed at alternative 5. Alternative between 2 rescue breath and 30 chest compressions for as long as necessary. Repeat the sequence of 2 rescue breaths followed by 30 chest compressions until the child starts breathing again or emergency services arrives. Don't forget to subscribe. Thanks for watching.